And I want to, as most of you know, I'm Christine Jacobs. I'm the Executive Director of Represent PA. We are the PAC in Pennsylvania that is exclusively dedicated to flipping and increasing, but we've always said flipping this, both chambers of the Pennsylvania legislature blue, but also putting in strong progressive women into roles, women who will represent all of Pennsylvania. And where it's 101 to 101 in the House, and we need to win a special election. But we also need to flip the Senate. And as you'll hear later, and I keep telling everybody, everywhere I meet people, is over 100 bills have passed the House and have not been heard in the Senate. 100 pieces of legislation that the Democrats have worked on and approved. 100 pieces of legislation that our Speaker, Joanna McClinton, has made sure got a hearing and were passed through the House and have not been heard in the Senate. And so our goal really is to add women to the House and to this majority and to flip the Senate so some of the vital work can get finished. And I want to remind everybody why we do breakfast briefings. Yes, it's our publicity and it's our way of talking to donors, but I view these to be our view of civic education. So many people have no idea what happens in Harrisburg and why they should care. And we want to connect the issues that our donors and potential donors care about with the work of the PA legislature. And we want them to know that this legislature can and should be working for you. And we want to highlight the issues and the work being done by the women we've supported. And this is a perfect example today of one that marries several of those points. You know, we've talked about healthcare in Pennsylvania, and I've noticed through the chat that we have several physicians and nurses and other people in the healthcare industry on the call today. We've talked about healthcare in general and access to healthcare. We've talked about abortion access, and it's been a big issue. And we've talked about impact of water and food insecurity on health, all of which tie into the health of Pennsylvanians. Today, we're going to hone in on maternal mortality and the work of one fabulous group of women legislators. You know, I'm not going to go into the issues. Our legislators and our guests today can talk about the issue. But I hope you all saw in middle of October pictures of our guests today, Reps Curry, Mays, and Cephas, as they launched the Black Maternal Health Caucus. And in July, Governor Shapiro signed Act 5 into law, which would started a committee to look at these things. As long as we've known Rep Cephas, she's been talking about the issue, but to raise it and get Governor Shapiro to act on it and start pushing forward has been a milestone. And I keep mentioning Rep Cephas. We've been a supporter of hers since her beginning of her time in the legislature, and this has been a cause that she has championed, and we're happy that she's got other reps with her, and they were able to develop this caucus this year. And joining her also is Latasha Mays, who we've talked about. Latasha was on a recent breakfast briefing we did, which talked about what's it like for new reps and how are they orienting themselves and how are they feeling about their work in Harrisburg. Next slide. And we've also had Rep Curry on the calls before, and she is in Delaware County, and we were happy to be able to support her. And hers was, both of the Rep Curry and Rep Mays both took over from other Democratic legislators. They didn't flip their seat Democratic, but they're both activists, and they're both women who want to get things done, and that's why we've supported them. I want to start today with Sara Heinze for the Maternity Care Coalition. I invited Marianne Frey, who is the head of the Maternity Care Coalition, to join us today. Actually, I didn't invite her. When I was talking about this subject with one of our big donors in the Philadelphia area, it turns out she's on the board of the Maternity Care Coalition, Nathalie Bartle. And Nathalie reached out to Marianne and said, hey, they're doing this topic. Don't you want to do the introduction? Marianne could not join us today for really wonderful reason. She's on a 40th anniversary cruise with her husband. But she delegated it to Sara, and Sara's going to give you just a little introduction to the topic, and then we can move into our main speakers. So, Sara, do you have a slide or two for us in the next 10 minutes?
I sure do. And I just want to say for folks who know Marianne or know of Marianne, the fact that she went on a cruise with her husband to celebrate her anniversary is a really big deal for her because she works really hard and no one deserves it more. So I am happy to stand in for Marianne, and I'll certainly do my best. Christine, thank you so much for the lovely introduction. My goal here today is to share a little bit more about the context on maternal health in Pennsylvania, more specifically Black maternal health in Pennsylvania. And then to talk a little bit more about Maternity Care Coalition. We're an organization based in Southeast PA, serving most of Southeast PA, but we also have a policy agenda that's statewide. And so I'm going to talk a little bit about the services that we provide and how we support pregnant and parenting folks, but then also our policy and advocacy agenda. So we can hop to the next slide.
That's great. And thank you for doing that. And she's going to do that all in about 10 minutes, folks.
Yes, ma'am, I am. Okay. So in addition to being at Maternity Care Coalition, I have the pleasure of leading a statewide perinatal health advocacy campaign called Thriving PA. And Thriving PA has put together phenomenal fact sheets for Pennsylvania and for every single county in PA. So if you need them, let me know. But we have an overview of basically the state of maternal health in PA. So you can see here the total number of births. I also want to highlight maternity care deserts and moderate access to maternity care in Pennsylvania. We have 6 maternity care deserts in Pennsylvania. We also have 13 counties that are headed in the wrong direction. In the time that this report was produced by the March of Dimes, we've seen a 14% decrease in the number of birthing hospitals in Pennsylvania. And so that's particularly alarming. What you can see here is a bunch of data pulled together called the Perinatal Vulnerability Index, which we put together at Thriving PA by our health. It includes by ourselves. It includes 5 domains. So behavioral health access, environmental context, healthcare availability, pregnancy and birth outcomes, and social stratification. And so we have, like I said, the data for each county, but the data that we've highlighted here, which I think is particularly important in understanding both maternal health and infant health, is low birth weight. Low birth weight is and I know that I saw Dr. Livingston, so she could probably explain it a lot better than I can. But low birth weight is of particular importance to pay attention to, because we also see some of the greatest disparities between Black infants and white infants in low birth weight, and that tells us a lot about maternal health as well. So like I said, I'm more than happy to provide, if anybody wants the specific county level data, feel free to let me know. So some of this you already heard, but I'll just cover it. We are expecting a new data from the Pennsylvania Maternal Mortality Review Committee in the next couple of months. So I don't want to harp on the data that we have that is maybe a little bit older, but I did want to provide just some specific context about the state of maternal health in PA. So our maternal mortality rate is 10.9 per 100,000 births. And that puts us at about 26th in the US. I've also seen 24th, but basically what you need to know is that Pennsylvania is right in the middle. So there's a lot of states doing better than us, states doing worse than us, but there's a lot of states doing better than us. I think something else I'd really like to highlight when we talk about maternal mortality in Pennsylvania is that when we look at the deaths that were specifically related to pregnancy, the Maternal Mortality Review Committee determined that 92% of those deaths were preventable. And so that means that there was at least some chance of the death being averted by one or more reasonable changes to patient, family, provider, facility systems, and or community factors. And so I feel like that's a really alarming number. 92% of the deaths that were reviewed could have been prevented. As you already heard, we have, like everywhere else in the US, there is disparities in birth outcomes for Black birthing people and white birthing people. Black birthing people and women are 3 times as likely to die from pregnancy-related complications than white women. And I think what's also important to note is when we look at maternal deaths in total, not just maternal deaths that were pregnancy-related, but all maternal deaths, 39% of those deaths, it was determined that mental health contributed to the maternal death, and 34% it was determined that substance use disorder contributed to the maternal death. So I really want folks who are less familiar with this topic to understand. I think sometimes when we think about it, we're thinking about like something that went wrong in the hospital, or you know, something that we consider maybe more like medically related. And those are, you know, those factors do influence birth outcomes. But it's really important to understand that when we're looking at the top causes, we're looking at things like substance use disorder and maternal mental health. So this is MCC. This is what we're all about. Like I said, we're based in Southeast PA, but really big picture, all the work that we do fundamentally boils down to this intended impact, where we're trying to do work to reduce social inequities and support parents and families in birthing with dignity, parenting with autonomy, and raising babies that are healthy, growing, and thriving. This is our theory of change. Marianne would be mad if I didn't share it with you, so I got to share it with you, but this is how we do the work that we do. You can see in the purple how we do what we do, and in the orange what we do. But we can hop to the next slide and I can dive in a little bit more specifically. So we do a lot, and we have a lot of programming directly for families. We also have community level impact, which I'm kind of going to skip over because it's self-explanatory. And then we also have our policy work. So on our next slide, I can talk a little bit about the the client level work. At Maternity Care Coalition, we have home visiting programs. We have an early Head Start center that provides childcare. We have a program that provides family therapy, both in-home and virtual family therapy supports for birthing people and their families. We have a community doula and lactation services program where we're providing direct support and education services, but also career opportunities. And finally, we have community and parenting education, in-person, online health and parenting classes. It's really important to highlight, when I was making this slide, I was like, man, the word support just comes up over and over and over again. But fundamentally, that's what all of our work is at Maternity Care Coalition, is supporting moms and birthing people in whatever way they need to reach their own goals. It's never about like a prescribed, you have to do this, this, and this, and that's going to be how your family's going to get on the right track. It's always about helping mom and birthing folks identify what their family needs and providing the support that they need to reach their own goals. So that's a very high level overview of what we do. Always happy to talk to anybody about the more in depth, but we can jump to the next slide. Okay. I'm actually going to ask if we can go to the next slide and come back to this one. I flipped them. I'm sorry, Christine. Okay. Policy and advocacy. All of our advocacy efforts are about supporting improved outcomes, right, for moms, birthing people, and babies, increasing access to early care and education opportunities. We've also added prenatal to 3 economic security. I think this is incredibly important when we're talking about how to support families in reaching their goals. It's phenomenal that people can have access to services, but we all know, and all the evidence suggests, that improving a family's economic security is one of the best ways to help them improve both long-term health outcomes, because economic security is one of the strongest predictors of health outcomes, but also sort of family support and stability. And so this is our sort of big picture policy agenda. I'd also like to point out that a lot of our policy agenda is informed by our clients and the communities that we serve. It's phenomenal that I get to turn to my colleagues and say, what are the biggest problems right now? What do families really need? And also sometimes being able to have a better understanding between maybe what's happening in Harrisburg and also what's happening for families and how that actually affects families. So if we go back one slide, this is our actual policy agenda right now, which I know Rep. Mays and Rep. Cephas and Rep. Curry have heard all about. But some of this is our Thriving PA policy agenda, and some of this is our MCC policy agenda. As I mentioned, we have huge concerns around maternal mental health. And I'll also point out that when we're talking about race and maternal mental health, what we know and what the data suggests is that Black women are significantly less likely to be screened and treated for maternal mental health concerns, but they're also significantly more likely to experience them. And so we have a huge disparity here, and that's something that we really want to target with our advocacy. So our first sort of priority for the next year or two is to establish a perinatal psychiatric access program, which would support providers in identifying and referring to treatment and services. We're also in a situation in which there is one group in Pennsylvania who does not have any access to health insurance during the pregnancy, and that's folks who are undocumented. So there's pathways to health insurance for everybody else in the state of PA, except for folks who are undocumented. We do know that they can access care at, federally qualified health clinics, but it doesn't really make a lot of sense. So if we're talking about health equity, we want to make sure that everyone who's a birthing person in PA can get access to health insurance. And there's a way to do that through CHIP. And so that's another piece of advocacy that we're doing these days. We want to make sure that people have access to supports during and after their pregnancy. And so we want to work with PADHS to, I think, really expand and improve an initiative that they already have around home visiting. Big one for this group here, we got to pull doula reimbursement across the finish line. Rep Cephas has introduced a bill for as long as I've been doing this. And it's been a conversation, and it's high time that we pull this one across the finish line. Very fortunate to have recently been named to the Doula's Advisory Board, and so the Doula Commission's Advisory Board. So I'm grateful to have the position to help support them in that effort. Looking to increase public investment in supportive services that we know work. And these last little pieces, you'll see our economic security policy, establishing a state earned income tax credit, and establishing a paid family and medical leave program in Pennsylvania. I'll just note at the end here, paid family leave is the only policy I have ever heard clients and staff ask for by name. Every time I talk to clients and staff, they either share like, hey, this is a concern or this is a problem in my community. Paid family leave, when I say what would improve your pregnancy, what would improve your postpartum period, it's the only policy that I've been asked for by name. And so I take my marching orders from clients and staff, and that's kind of Maternity Care Coalition in 10 minutes, Christine. I am happy to hang on and answer any questions.
You hang on, and you may both get questions later, but you're also going to be really inspired once again by our legislators, and it'll push along your policy initiative, Sarah. So thank you very much.
Absolutely, Christine. Thanks for having me.
Thank you. And now we turn to Rep Cephas, who I mentioned earlier has, and I love the way Sarah said, as long as I've known her, she's been pushing this. And that's what I said earlier, is we're really proud that we've supported her all along, but we've also increased the number of people, women of color in the coalition, in the state legislature, so that she's been able to develop this caucus. It's taken too much time, but we're changing Harrisburg one strong progressive woman at a time. And that, take it away, Rep Cephas.
Thank you so much, Christine, for inviting us for this conversation. I want to say, to your point, every time that I'm on with Represent PEC, this is the #1 topic that we're talking about. And, I'm happy to say, since the last time I've been on, I've been joined by 2 amazing change makers. And, just to give you a little history really quickly about Rep Mays, she was the first one that actually introduced me to the topic. I had an opportunity to sit at a roundtable with Senator Bob Casey with a group of Black women when he was running for re-election. And, a young person asked, what specifically is Pennsylvania doing about the issue of maternal mortality? And as an elected official, surprisingly, I just had a blank stare and totally told them that I will get back to you on that issue. And, in that same year, I traveled down to the Congressional Black Caucus, and I saw Rep Mays from Pennsylvania screaming at the top of her lungs about the topic and what some of the things that Pennsylvania could be doing. And to have herself and Rep Curry, who immediately hit the ground about maternity care deserts, really helped, launch the issue and made this really a focal point for, not just myself, but, specifically for our caucus. And, I want to thank Sara Jann for, raising the issue of how Black women are disproportionately impacted by this issue. I mean, we all know the statistics. We all know that our country is still trending in the wrong direction. During COVID, the New York Times talked about there being a 14% increase in maternal mortality deaths. We have close to 800 birthing people dying each year. And again, Pennsylvania mirrors that trend and is absolutely going in the wrong direction. But it's particularly really important to, address the issue of Black women as it relates to this issue. Here in Pennsylvania, Black women represent 14% of the birth, but 23% of the deaths. And these were statistics during during the 2013-2018 period. So when we see the next series of reports released by the Maternal Mortality Review Committee, I'm sure it's going to be a startling statistics that, again, are still going in the wrong direction. And the reason why we focus on Black women is critically important. There's this policy framework called Black Women Best. And it's the idea that you use a framework of policy and legislative actions when they focus specifically on Black women. Our communities tend to go into the right direction. So it's almost, rising tides lift all boats. So if we really impact those numbers as it relates to Black women, we will have an immediate impact on the community at large. And, since, I joined the legislature and started this work, we've seen tremendous strides and a significant focus on this issue. I'll talk a little bit about some of the recent wins that, we've just recently gotten. Christine, you talked about Act 5, which is Senate Bill 262. I have the companion bill in the House, but I always say if the Senate can get it out of its chamber, we will steam full ahead in the House. But thankful to co-chair of the Women's Health Caucus, Judy Schwank, championing this issue over in the Senate. And it essentially requires our Maternal Mortality Review Committee to begin tracking maternal morbidity. And, I do want to mention that, this issue of maternal health is a bipartisan issue. When we talked about the Maternal Mortality Review Committee, it was actually originally a piece of legislation from my Republican colleague, Ryan McKenzie, who actually spearheaded that legislation. And from there, we then got, again, Senate Bill 262, which now requires reporting of maternal morbidity. Because if you think maternal mortality, our numbers are bad. For every maternal mortality death, that represents about 7 to 10 individuals that are experiencing maternal morbidity. And this is, a long-lasting impact of, their birthing experience that can have an impact to their economic viability, their access to education, and their ability to just live their lives regularly as a result of those complications. So it's important that we're tracking that issue as well. We also were able to secure $2.3 million from the governor in his budget address or in his budget proposal. And I know Rep. Mays will talk a little bit about that moving forward. But we also have been able to put doulas in our correctional facilities for women, both in Muncie as well as Cambridge. And just recently, Muncie opened its very first lactation station for birthing people that are in that facility. We also have been able to help create and formalize a doula commission that's going to help certify, train, and financially support doulas to help secure their certification and their licensing. We've also been able to, and I know we've talked about it continuously, expand Medicaid up to a year postpartum because we know that over 51% of the deaths are happening during that period. So, we've been able to secure a lot of significant support as well as resources. Again, there's a significant legislative agenda that my colleagues will talk about. But, as we've mentioned, the time is now to really address this crisis, not just here in the Pennsylvania, but across our country. And our main goal with this caucus, and again, my colleagues will talk about it a little bit more, is to make Pennsylvania the poster child when it comes to tackling this issue. So the goal is in our tenure, now that if we're 26, this year, hopefully over the next 5 years, we'll be 15th. Again, with the idea of ensuring that, we're protecting birthing people across the Commonwealth of Pennsylvania. So those are some of just the brief highlights on what we've done. And this is pre-Black Maternal Health Caucus, but, now that we have this caucus, we'll be digging our heels in deeper into the issue and, looking at what resources that we need to continue allocating. Governor Shapiro did say the $2.3 million is a down payment as it relates to this issue. So we are going to hold his feet to the fire. The great thing is all three of us are on the Appropriations Committee, so we will definitely be able to, follow up on that. I do want to turn it over to my colleague, Representative Mays, who again, is more of a subject matter expert in this issue than I am. I feel like I just been carrying her water till she joined me in the legislature. And I know as we form this caucus, we are going to be able to do a lot of great things in this space.
Thank you, Rep. Cephas. I always say that she is our OG in this work and in this legislative life. Thank you all for this opportunity to come and share the great things that we are doing with our Black Maternal Health Caucus. Again, I'm Representative Latasha D. Mays. I use she, her pronouns. I represent the 24th Legislative District in the city of Pittsburgh. I am from Philadelphia as well, and have done work in both Pittsburgh, Philadelphia, across Pennsylvania, and also in Ohio. Many of you may be familiar with the fact that I led New Voices for Reproductive Justice for 18 years, and that very much informs my lens in my life, my lens as a legislator, and my lens in policy. So reproductive justice is at the center of everything that I do. And so for those who are not familiar, reproductive justice is a movement. It is a social change movement that was created by 12 Black women in 1994. It is also a framework, how we approach every issue or every advocacy campaign or every piece of policy or legislation, and looking at our lived experiences with white supremacy and patriarchy. And then also it is a practice. It's how we live. It's how we view the world. It's how we treat our fellow legislators. It's how we engage with our constituents. If you're a medical provider, it's how you treat your patients. If you're an insurance company, it's how you take care of your clients. It's a broader, powerful, transformative approach to how we do the work of reproductive freedom and ultimately our liberation as Black people and people of color. So that is my foundation, and it's important for you all to know that in how I talk about Black maternal health. That wasn't work that I always thought about. It was very abortion focused early in my career or early on my journey. But my first encounter with Black maternal health was in 2010, when mostly Black incarcerated women were being shackled in our county jail. But I didn't know that that was about Black maternal health. Now, we think in an intersectional way. I totally understand it now. But back then, we just thought it was about mass incarceration, and we knew it was about gender as well. But over the years, I had to really reflect upon, when did I first come to this work around Black maternal health? And that was it. We were successful in banning shackling in our Allegheny County Jail. We were successful in getting a statewide bill passed in 2010 to end that practice in the state, but it wasn't enough. And it's because of legislators like Rep. Cephas understanding that we have to go farther than we had gone with that previous legislation. So for the past several years, it's been such an experience to deepen my knowledge around Black maternal health and understand the root causes of where we are today. And yes, we know the answer is racism, but it's specifically medical racism. If we look historically, we understand that our system of health was never intended to serve Black people in any way, shape, or form. If we look at history, we'll understand that gynecology was built off the backs and bodies of Black women, enslaved African women. So if that is a part of our history and foundation in our healthcare system, we shouldn't be shocked to see the types of statistics and the types of experiences Black women, Black mamas, and Black birthing folks are having today. So we have to understand where this all begins. I have the great honor and fortune of working with Rep. Cephas and Rep. Curry in creating the Black Maternal Health Caucus, and that we are clear that we need a bold approach to changing and reversing and ultimately ending Black maternal mortality. 92% preventable deaths. 92%. So almost all of these deaths are preventable. So what are we doing as a Commonwealth to ensure that that number reverses in the other direction? And until it does, we have great work to do. So that's just a little bit about how I came to this work. I want to turn it over to my colleague, Rep. Gina Curry, Rep. Gina H. Curry, to talk about how she came to this work, our first effort around Black Maternal Health Week, and how that led to the caucus. Rep. Curry.
Thank you so much, Rep. Mays and Rep. Cephas and Christine for having me today. I'm super excited about this work. And, you know, when I was sitting there listening to my colleagues speak, how important this work really is, how important it is for Pennsylvania to be a leader in this work and to be change makers at such a critical time. And so when I think about the fact that this is a critical time, often we all jump on the bus at the same time. And so right now, everyone is jumping on the bus. We know that there have been people, as Rep. Mays has talked about her history, and Rep. Cephas, who have been on this bus for a while, but there was not a lot of attention placed there. We know that there are OBGYNs on the line, like my dear friend Cherie Livingston, who have been doing this work for a long time with patients are waiting. We even know that there are other women's health issues that have been waiting in the balance for, as statistics continue to rise, particularly impacting, affecting, and traumatizing Black families. And so we know, I'm the proud co-chair of the Women's Health Caucus, was given that opportunity as Rep. Cephas moved out of that space, and also as the PA Women's Commissioner, and now co-chair of the caucus, the PA Black Maternal Health Caucus. I know that there's so much work to be done. But as you might have seen my my profile up on the page, if you look at it, I came in and PA Represent helped me because they knew that I was a fierce fighter for public education. That was it. They found me and they were like, oh, we need this one for education purposes. And they supported me and got up underneath me for that. But we all know that our purpose comes in different forms. So as soon as I got in office, DCMH, which is Delaware County Memorial Hospital, which is no longer, sadly has closed, created a maternal desert in Delaware County, which was right around the corner from my district, which is now Representative Boyd's. But literally, I can see it from my office. And a nurse called and said, Representative Curry, I know you just got here, but the maternity department is closing on January 29th, and you need to help us. And I said, oh, I don't know. I mean, I'm a mother of 3. I've had 3 births. I'm a Black woman. I know that our birthing experiences can be challenging, but I've never had a voice in that space, just my own with my own friends, talking about our experiences, right? So immediately I was like, okay, I've been tasked. And so I got on the phone, of course, with Rep. Cephas, and I said, okay, what are we doing here? And she said, well, you need to put together a policy hearing. So that was actually my first experience. And I put together a policy hearing right at Bonner Prendy, which is right in the backyard of DCMH. And we talked about maternity deserts and how they're tremendously impacting women, and especially women who have lack of access. And I found out how much that impacts the maternal mortality and morbidity rates, not having that access. And then I had another big conference November 1st of last year with the acting secretary of health and at Petaway Pursuit Foundation, which is right in my district in Lansdowne, who had been heavily impacted by an MCO that decided she no longer needed to be funded. So I was catapulted into this space, but so excited because knowing that there was so much that needed to be done, and then coming in line with some of these pioneers and tremendous women on the line who have been doing this work. And I'd be remiss if I didn't call out the smaller orgs like Petaway Pursuit, who I didn't know how they were even funded and what that meant for them when they get shut down and don't have funding. What it really means is that we have created a more of a hole in our communities, more of a slap in the face to women who we know the rates of their death are as high as they can be right now. As we talked about, 92%. And I heard that for the first time when Dr. Livingston came to our policy hearing during Black Maternal Health Week at the Capitol, that 92% can be preventable. And so we've done this work so far within, I want to say, a year and a half. And when Maternal Health Day came up last January, Mariah Hathaway and myself, who runs the Women's PA Commission, we were like, what can we do? What can we do? And time ran out on us and administration was changing. And so I was like, let's push it all into Black Maternal Health Week. And so that's what we did in April. We pulled together an amazing acknowledgement for the first time ever at the Capitol. And so many women and stakeholders converged upon us. We had some amazing speakers. And we sat in a room together and had a policy meetup about what this looks like. And the fact that we already have done all the research, that we knew that the budget hearing was coming, the budget, we knew that there had been money set aside on a budget line item for the first time ever. And we were determined to move this into a space. And 6 months after that April day at the State House, we have launched the very first Pennsylvania Black Maternal Health Caucus. It's historical. It's a historical space that we know we are going to do some amazing work that we've already started. But that's how I got involved. And I'm so excited to be here and honored to have this responsibility and accountability as a legislator in the Pennsylvania State House. So I just am excited that everybody is here on this call, and we're looking forward to working together, because what I've been saying is we can't elbow each other out of the way. We have to listen to everything that's coming down so that we can really make this work effective, because the bus is leaving the station and we need everybody to be on it. So I thank you all for allowing me to tell you why this is important to me and why we need to get moving and not let any time waste. Because I will say this one last thing. I had a personal experience that we've been talking about. And when we had the bill signing on the 31st, I got a phone call from my staffer at 7:30 in the morning that her sister-in-law had died at a hospital in Philadelphia of a pregnancy-related death. And they buried her last Saturday. So this is very personal, not only for me, and it should be very personal for everyone on the line, even if you haven't been directly impacted, because these are the things that are real time, real life, and impacting families.
You know, Rep. Curry, you mentioned that you thought Represent supported you because of your education focus. And that would be true because that's what you focused on in your application. But the first time I met you in person was at an event we did in West Philadelphia, and Rep. Donna Bullock was there. And when you spoke about what your background was, Gina, Donna turned to me as an aside during this and she said, "Where did you find her? And how can I keep thinking about all the places we could use this fabulous woman?" So, you know, I was, and you're just proving that point to us over and over again. I put a couple questions in the chat, but it's your meeting, Morgan. I put a couple questions out there, both to everybody out there. What would you like to know more about? But Morgan and Gina and Latasha, what do you want from us? You know, what can we do to support you further? I know my goal is to put you with more solid majorities so that you can do the work that you know better than any of us. I also know my work is to get us a Senate majority so that we can get some of this done. But what else do you want, reps, in order for us to support your work? Because there isn't a person on this call who isn't touched by what you're doing.
So one of the things that we didn't get a chance to talk about was, you know, what's next as we launch this amazing caucus, as we pulled stakeholders, had an amazing press conference, and, you know, are extremely excited about the work. But, you know, essentially, what's our plan moving forward? One, I want to say Rep. Mays' biggest dream is to come up with a Pennsylvania version of a momnibus bill. And, you know, that includes policies and, you know, legislation that, again, will tackle the issue in a short term and a long term. So, you know, that's definitely number one. Another, you know, piece that we'll be doing is having a series of policy hearings related to the issue. So, you know, I want to say Rep. Curry's up first with a policy hearing that'll focus on maternity care deserts. And, you know, what does it look like to, you know, rebuild the infrastructure? What does it look like to make, you know, investments that will strategic investments, innovative investments to, again, you know, give people access to, you know, quality maternal health care. And, you know, how do we define them, but also how do we, you know, trigger some type of investment to, you know, ensure that, again, that infrastructure is there. But also, what do we look as it relates to, you know, policy shifts? Again, Governor Shapiro is keenly focused on this issue. And again, talked about that $2.3 million that he made as a down payment in this effort. One of the other things that we did, and I saw, you know, somebody mentioned, you know, technology in the chat. We put $25 million worth of American Rescue Plan dollars towards maternal health, and $5 million of those dollars directly go to, you know, innovative ideas or innovative technologies to, again, bridge that gap. One of the pieces that I love to uplift is Heart Safe Motherhood, which was technology developed by the University of Pennsylvania that sent birthing people home with blood pressure cuffs to help, you know, their doctors, their physicians monitor their health and to get them access to the care that they need. So, and I raise all of these issues is because that's one of the ways that you can help. Outside of, you know, expanding our majority, again, you know, we definitely need that financial investment to do that, to ensure that we're not a humble majority, as we all like to say, but also investing in the Senate. Again, you know, I jokingly say if you get it through the Senate, we'll get it through the House. But it would be great if, you know, we can set the agenda beyond just protecting access to, you know, reproductive rights and, you know, abortion care. We really want to set the agenda for, you know, maternal health, because again, if we really are focused on protecting lives, we have to do that throughout the duration of the pregnancy. So I know no one asked that question, but I didn't want to leave this conversation without saying what's next and how you all can be helpful in, you know, being experts in this space and helping to inform the work, but also connecting the work in the series of different groups that, you know, are leading this effort. I don't know if my other colleagues wanted to chime in.
For sure. Thank you, Rep. So one of the things that we wanted to also share with you is that we have 32 members in our caucus, and it is a bipartisan caucus. So a way you can also support us is encouraging our current members to join the Black Maternal Health Caucus, especially as I'm sure they'll be going through this endorsement process with you again. So that's important to us. And what you should know is that our caucus is inspired by two caucuses, the federal or congressional Black Maternal Health Caucus, created by Rep. Alma Adams and Rep. Lauren Underwood in 2019. For me personally, I was deeply inspired by the formation of the Ohio Black Maternal Health Caucus, and both of those formations is what, this conversation goes back to 2019 between Rep. Cephas and I. And so, I'm not wasting any time as a first year legislator to bring things into fruition, because if not now, then when? If not now to address the mortality and overwhelming morbidity that Black mamas are facing, then when? If we're not going to address hospital systems who perpetuate and MCOs who perpetuate Black maternal health mortality and morbidity, then when will we do that? So, we need legislators who are bold and understand our vision, and Represent PA can encourage your current legislators and those who are seeking to be part of the House and Senate to see where they stand on Black maternal health. That's a question you can ask them when they're applying for your endorsement. Where do they stand on Black maternal health? What have they done for Black maternal health? Would they consider joining the Black Maternal Health Caucus if endorsed or elected by Represent PA? So that's one tangible that you can do. Another thing I wanted to discuss as well is that our caucus is full of amazing, incredible stakeholders, as well as our members of the House and Senate. We are working directly with Black-led, Black-serving, grassroots, frontline Black maternal health organizations who are doing work and reaching people that would never be reached otherwise. And so they are very much at the center of our stakeholder arm of our caucus, which is critical. And that we have to understand that they are working, as someone who led a nonprofit, so I'm speaking from firsthand experience, the ways that we have to beg, the ways that we have to scrape together funding and resources is shameful. And so these organizations doing incredible work to combat mortality and morbidity among Black mamas and birthing folks deserve better. They don't need intermediaries. They are able to do their work and carry out their work just fine. And we want to see them get dollars that go directly to them, directly in their hands, so that they can serve their constituents.
Rep. Mays, if I could ask you a question about that. Are you looking for volunteer money, philanthropic money for that? Or are you looking for the state government to do their job and get funding to organizations so they can get the work done?
So for our caucus, part of and I can address that, is we've outlined how we know that initial $2.3 million can and should be used. And a large portion of that is directing state dollars to these types of frontline Black maternal health organizations. Mm-hmm. But surely any donor on this call, can donate directly to these organizations. But there's often the way that our infrastructure is with our state government makes it harder. It almost makes it impossible for a smaller organization to get the level of funding that they might need, or to pursue RFP or RFA from the state. So how can we, supporting these types of organizations to do that? I remember looking at state grants and I was like, no, we're good, because it was beyond our ability and capacity to do it, even though we were doing Black maternal health work. And so that is something that we are trying to change in the infrastructure, the processes of our state funding and budget appropriation system. And like Rep. Cephas said, we all serve on the Appropriations Committee, which has helped us tremendously to understand the level of investment that is needed. So, we are 2.3 is a start. It puts us in the budget, but it is certainly not the end or the ceiling for where we want to see in terms of what we want to see in terms of investments. And so we have outlined a letter to the governor. We have shared it with a variety of department secretaries, including Department of Human Services and the Department of Health. And so we want to see an Office of Black Maternal Health or Maternal Health Equity established within our government, and can really administer some of the programming that we want to see. And I'll save you the details or the, on that for now, since we're coming to a
Send it out to us, because one of the things we do after all of these calls is we do send out not only the link to the chat to this event so that people can share it with folks, but also further resources. So feel free to share with us anything you want us to get out there. You should also know that the Secretary of Human Services, Dr. Valar Kush, is an original supporter of Represent. She has been on our, she's supported us since we started 8 years ago or whatever it was. So we're happy about that, and anything we can do. And somebody asked, you mentioned Rep. Mays, what the governor was going to do. Will he follow through, and what help do you need from us to make sure that he does?
I believe he will follow through, and we will be there to help him follow through. And so you help us help him follow through. So that's a way you can be supportive. And I know we're coming to a close, so I want to open space up for Rep. Curry, Rep. Cephas to add anything else.
Yes, thank you, Rep. Mays. I do want to also include the fact that, I think I said this earlier, as MCC outlined, we already have all the data. And so here's the thing. We need to be able, as Rep. Mays said, be able to get the funding for the smaller orgs, because education is key. We have to continue to educate, because I think, as Sara said earlier, or it might have been Rep. Cephas, people think that these things are happening in the hospital. Unfortunately, it happened to my staffer, but it's a lot of times once they leave. And then I just want to bring up the fact that I've spoken at several events where you'll see Rep. Cephas and Rep. Mays and myself being out in Pennsylvania, going across the Commonwealth to help people understand what this is about. Because what we want to do is, excuse me, break down any barriers around racial disparities, to say when people hear PA Black Maternal Health Caucus, that they're not saying, oh yeah, that's for Black people, or that's for people in that community. That's not what this is. When we make Black maternal health better, all maternal health gets better. And so we want to continue to help folks to understand, and that's through education. We want to make sure that when we're asked, just like you ask us today, Christine, to be on this call, we need more calls like this to continue to educate, but not only educate folks that are already progressive and on board, we need folks on the other side of the aisle. I very specifically, as the Women's Health Caucus chair, know that some of our members, most of our members on the other side of the aisle, are not interested in this women's health care issue in this way because they're afraid of abortion. Let me speak transparently. That's one of the reasons we started this caucus, because this caucus is about Black maternal health. It is also about reproductive justice, but it's about Black maternal health. And so when we speak in terms of that, everyone needs to be signed up. So if you know people in other parts of the Commonwealth, push them to talk about this, push them to say, we're not voting for you unless you sign up to understand what's going on. Because I'll be honest, the statistics, Pike County, Carbon County, Lehigh, these are all spaces in that part of the Commonwealth that are suffering at high rates of Black maternal mortality and morbidity. So my ask is that we continue to educate. I went down to the Congressional Black Caucus. I was at Once Upon a Preemie, which perinatal health is a part of this conversation. We need everyone on board. ACOG was asking us to get something together for maternal deserts. Everyone needs to be on board. So everyone that's on this call, it is your responsibility to be completely upfront, now that you've heard this, to talk about what is necessary and what is needed. And I appreciate you again for having us on today.
Rep. Cephas, do you want to close?
Absolutely. So first and foremost, I want to thank you all for participating in today's conversation. As my colleague said, this is just the beginning for us. We have, a lot of runway. We have a lot of focus. We are in a very pivotal moment right now as it relates to maternal health. I want to say in my Sunday running of shows, it starts with Sunday morning, then goes to Meet the Press. Meet the Press featured the issue of maternal mortality and specifically talked about Black women being 3 times more likely. And Sunday Morning talked about it once on their show as well. So, the time is now for us to really dig our heels into this issue and be laser focused and intentional in every aspect of what we do. So when it comes to, the upcoming budget conversation, what does that look like? When it comes to the next iteration of legislation that we need to move, putting together the omnibus bill and ensuring that we have that here in the Commonwealth of Pennsylvania. But also when we have a Democratic governor, what is it that they can do from a policy perspective that really can move the needle on this issue? So, I thank you for joining the conversation, but I also want you to get involved, as my colleague stated, utilizing your expertise to, help us put together proposals that, we need here for the Commonwealth of Pennsylvania. So again, the work is just beginning. Thank you, thank you, thank you for featuring this conversation. And last but not least, please invest and represent PAC, because we need more people in our General Assembly to be able to carry this message to really tackle the big challenges of maternal health here in Pennsylvania. So thank you.
Thank you all 4 of you for talking today. I think it was just an incredibly wonderful, lucid, clear call to action for all of us. Let's just put in our few closing slides, please, Tiffany. Represent PA believes in reflective democracy, and you've heard me talk about this if you've been on any of our other calls. And reflective democracy means until and unless our elected officials look like all of us: race, gender, sexual orientation, religion, economic background, whatever measure you want, issues aren't heard. This has been an issue forever in Pennsylvania, but until we get more women, this is not discussed. Until we get more Black women, this very important issue is not discussed. This isn't an off year for us. We're trying to raise money. Next slide. We've got another special election coming up. John Galloway won a district court seat, so we're going to have our 3rd special election from January. We need a solid majority, because I know it's hard sometimes for Speaker McClinton to get everything done that she wants, even with a Democratic majority, because not all Democrats are aligned. Next slide. And we're having an action meeting. We're going to have it in November. It's been moved to, we're having it in a couple weeks. And we call it our Path to Victory. If you haven't been invited, but you think that you should have been, let us know. But we're talking about what seats are available, what our plan is for getting the majority, what our plan is for increasing the number of, making sure that our legislators are tied into this issue of Black maternal mortality and increasing the caucus for them. Next slide. And we're always looking for volunteers. So again, thank you to everybody who was on this call. I feel it, and I'm assuming most of you feel it also, that this is just really important. And it's something we'll use our social media to make sure is elevated also. So thank you, everybody.
Thank you.
Thank you. Great forum.
Thank you. Take care.